to connect personally and not over a screen. I'm pretty laid back, so if you have a question or if a slide doesn't make sense, please just raise your hand, shout out if I don't see it. I like to answer questions as we're going on because then you forget, and it's better just to kind of do it as we go through, okay? Today we're going to talk about osteoarthritis, new therapies for an old disease. Osteoarthritis, we all know, is one of the most common and most debilitating disease that we have in dogs and cats. We see it every day. In fact, I'd say that we see it multiple times a day. Whether we or the pet owners recognize that, 80% of dogs over the age of 8 are going to have some degree of arthritis. And 35% of all dogs of all ages. 90% of cats over the age of 12 are going to have some degree of osteoarthritis, and 40% of all cats. And this is really important. I don't know if everybody's noticed if there's been a big push over the past maybe year and a half about recognizing cats' pain and managing that. Cats are very difficult. We'll go through that later on having owners recognize and not just say, oh, it's just that they're getting old or they're just laying around more. So if we have 90% of cats that have osteoarthritis, I just want you to see this. 13% of affected cats are actually diagnosed and treated. Part of that lays with owners not recognizing the problem. Part of it lays with us as well. And when I say that, I say it lovingly. I'm a general practitioner at heart. I did that for 17 and a half years. It's kind of hard to stop that. When I see a patient, whether I'm here or I'm working per diem at a general practice, I ask myself about that particular animal. What does that animal look like to me? Oftentimes we see these animals come in. They're coming in for vaccines. They're coming in for geriatric blood work. The thing we have to ask ourselves is, what are we looking at? Do we really see that animal? Do we see that, like Jake here? This is Jake. He's a very sweet dog, but his temperament was changing. He was having trouble walking. His back was sliding down. The owners didn't come in initially for that. They came in because he was limping because he had a TPLO years before. But they didn't see everything else that was going on with him. Or like Velvet here. Do you notice her legs? Her owners didn't even notice that anymore. That's the way she's always been. Or this cutie here. This is my dog. She has bilateral ACLs. She had bilateral TPLOs. She has elbow dysplasia. She has hip dysplasia. So, yes, right? All those great things, right? So when we see our patients, part of our brain should start looking, okay, I have a geriatric dog. I got to ask some questions to see, is she having these problems that the owner may not be recognizing? Same thing for cats. We have to look at them. This is our cat too. This is Hoops. He's almost 18. But asking questions to owners like, hey, have you noticed changes in behavior? Have you noticed that he's not sleeping where he usually sleeps? Have you noticed that he doesn't want to climb? There are a lot of questions that we can be asking that can target whether any cat has problems. So we know that osteoarthritis, it's a disease that progresses and is progressively debilitating. It's going to get worse no matter what we do, and that's a really important point to make to owners. We cannot stop the progression of arthritis. We can slow it down, we can help an animal, but we cannot stop it, and it's going to worsen over time. So the sooner we intervene, the longer we're going to have to make this dog comfortable. Again, if you leave it unmanaged, it progresses, and pain and discomfort get to the point where animals have poor quality of life, and they're often euthanized for that. And it gets difficult not only for the pet, but for the owner too. If you have to lift an 80-pound dog, if I had to lift my 80-pound dog, it would be difficult. It's a hardship for owners many times. And again, the number one cause of euthanasia in many of our geriatric patients is they can't move anymore. And usually that's osteoarthritis. We know that intervening early in the OA process is crucial in slowing it down. Again, we cannot stop it, but we can maintain their comfort longer if we start intervening earlier. Most of our pets, however, come in looking like this. You know, this is my favorite when I have a patient who looks like this. They come in, and people are actually wheeling them in. They're in a cart. They're not a cart, but a wagon. And the owners are like, oh, this is the way I take him for a walk. Like, does he ever walk? No, he can't walk anymore. Now, how long has that been going? Oh, probably the past year. Okay, well, again, if we had seen this dog a year ago, we may have better luck in helping them. But, you know, there are a lot of things that we'll see him like this. We wouldn't be able to see him prior to these end-stage advanced OA pets. So why is there a delay? Well, there's a lot. There are a lot of reasons that are going to come to play. Trust. Sometimes our clients, you know, you just want more money. You just want to do this. You know, right? You're shaking. Right? Isn't that true? Trust is a big issue. Owners' time. They don't have time. You know, everybody has busy lives. You know, they were supposed to make an appointment. They forgot 6 months later. You know, in the meantime, that dog's had 6 more months of discomfort. The other thing is the perception that this is all normal. My pet has gotten older. This is normal for it to be like this. Those are where discussions come into play, where we tell them, well, it is normal. It's a progression. Yes, they're going to have problems, but your dog being in a cart is not normal. They oftentimes will present with pets will present with behavioral issues, and owners just think they're being grumpy. They don't know why, and we have to kind of discuss that with them. Being grumpy, having behavioral issues, oftentimes is a sign of discomfort and pain. And then the other subtle signs that they won't notice: they're not jumping into the bed anymore. They're sitting at the bottom of the stairs. You know, they walk away from the kids. They don't want to be interacting. And the one that I guess everybody can kind of relate to is money. Money is a big thing. A lot of the treatments can cost, not initially, but long term, because most of our therapies will go on, like even if it's once a month. You know, that could be a lot of stress on financially for people. So how do we intervene earlier? How do we convince owners? It's not that he's just getting old. How do we start and get owners on board with a plan? So there are early detection practices that we can use. There's education, which is very important. Communication with the owner is very important. And providing them with a management plan that's going to progress with each patient. And it's going to change based on that pet's experience with arthritis. So early detection, again, it's hampered by lack of recognition, misinterpretation of signs, underreporting. The owners don't even care to think about it. Stoic dogs and veterinary complacency. And I don't mean that in a bad way, but we're busy. You know, when you're in general practice, you know, you have 5 people waiting, you have a 15-minute appointment, you have somebody in emergency that's coming in. It's very easy to kind of let that go on the back burner and say, I'll take care of it another day or next time they come in. All right. But it's aided by addressing those incidental findings. Like you're palpating, you feel the knees, and they're crunchy and they're thickened. Just mention it to the owner so that you can start a dialogue. Observing the pet when it's walking. It's amazing that people won't notice that they're limping. Asking questions and discussing what's normal for their pet. Because many dogs you'll see, you know, like they're Shih Tzus that have, you know, deformities in their legs, that yes, it's normal for that patient, it's normal for that dog, it's a genetic issue, but we may want to still discuss it as the consequences of that. And also using clinical metrology instrumentation or questionnaires, and we're going to get into that very briefly because I really want to get into the 3 topics that we're going to talk about. So pet caregivers do not recognize signs of OA. We know these. We've seen them. We talk to people about them. You know, limping is the most obvious, but many times dogs aren't limpy when they come into the office. You know, difficulty rising, sitting funny, you know, not going up the stairs, not getting on the beds. There's a whole list of them. But if you give a questionnaire to an owner, they may start kind of thinking about that and saying, oh yeah, my dog does this. They get home, they notice things more, and they may come back and say, you're right, these are the things that I'm seeing. Thank you for the questionnaire. Same thing with cats. Online resources are really important with cats because cats are much more difficult to look at and say, oh, it's limping, oh, it's not going up the stairs. So the online questionnaires that you can get, and Zoetis does a great job about their online resources, you can give it to the owner, have the owner interact with it online, and they can come up and look, inappropriate litter behavior, biting, growling, running away from owners, reluctance to go upstairs, reluctance to be picked up. There are a lot of little things with cats that once they're online and they go through this questionnaire that they can pinpoint. The biggest thing is that we have to remember cats, young cats, are vertical livers, meaning that if I put a cat here, first place he's going to go is right up on that cabinet over there. All right? They like to be high up. Older cats, or arthritic cats, they become horizontal livers, meaning that they want to be on the ground. They're sitting on a little bed that's on the ground rather than on their tree. They don't want to climb their cat tree anymore. They don't want to climb the stairs. So those are things that really that change is something that makes it very easy for owners to kind of say, hey, yeah, I don't see her jumping up in her favorite place anymore. 2 points, progression from a vertical life to ground dweller, just as we were discussing, until recently was considered normal for cats. But with a lot of research and a lot of Dr. LaSalle's down in North Carolina has been working a lot with Zoetis about creating checklists that owners and veterinarians can use to kind of say, okay, this change indicates a problem. The other thing is cats present a very unique challenge. Even when we're doing PT, it's basically hands-off. But when we have them in the office, what do cats do? They hide in their carrier. They go underneath the chair. They're not walking around. They don't want to be touched. They're growling. It makes it difficult. So cats, unique as they always are, we do special things. So since they are stoic and unique in their clinical presentation, it's really important that we use online resources. The other things that we can use to help us are owner-captured videos, so they can at home, because the animal's acting normally, they can take videos and bring them in, or they can email them. You can have a Zoom meeting, since we're all used to Zooming things. The pandemic really helped with that. And using checklists and the clinical metrology instruments. Owner-captured videos, they're wonderful because this isn't something that you're going to see in the office. You're not going to see that they're laying on the close down to the ground. You're not going to see them hiding. You're not going to see them fighting with their housemates. You're not going to see them urinating in place. You're not going to see them hopping up the stairs rather than going up. But if the owner can capture that on video, it's going to give you a lot of information. In the room, this is the way that we usually see them, in their litter box, hiding, just the eyes over the sink, hiding in the sink, knocking everything off the counters. So when they come into your room, open the door, open their carrier, let the cat, don't let the dog in, let the cat walk around and watch them walk. Watch how they interact. Watch where they go. Watch if they're jumping up on things. So you can kind of see in a more natural setting what the cat is doing. And then, of course, a veterinary exam, slow and consistent. Cats don't like to have they like hands-on all the time. They don't like to be touched and then let go, and then touched and let go. So kind of just making it a continuous motion and kind of like focusing on probably the problem places that you see first and then getting to the other areas later. The other thing, there's nothing wrong with using a little gabapentin. Works great, all right? How many people are using gabapentin on their cats? Works great, right? The other thing are checklists. Zoetis has they did the whole OA in cats, and they have really cool interactive checklists that owners can get online and kind of play around with. And it has little videos to show what does the animal look like when it's painful, or how is it playing, or how is it changing, how is it crouching. So the checklists are wonderful. They have them for both dogs and for cats. And then there are other things like the canine brief pain inventory. There's load. There are a lot of other actual measurements that we can use to kind of monitor how a pet is doing with arthritis. These are the OA checklists for dogs. Again, Zoetis Pet Care or Dog Checklist, Zoetis.com. They have printable versions. They also have online interactive versions. You can, just mention it. to the owners. Hand them the website or a paper and say, I'd like you to get on it and see where he fits in this group of animals. This is the Zoetis, this is the interactive, but you see how it shows like a normal cat and an abnormal cat? And people, if they visualize things, they tend to understand it better. So it's a great way to start the conversation, all right? What are the best ones to use? Well, the best one is the one that works best in your hands. The one that everybody in the practice feels comfortable using, because it's not just something you're going to do. You can actually have your technicians help you get the owners onto the websites or using it on paper. It's the one that you can integrate and remember to use. You know, some of them are a little bit more difficult to use, but if you can say, okay, this is the one that I've learned and I'm very happy with it, I can use it each time, comes out very naturally, that's the best one for you to use. The one that your receptionist can understand, the one that makes your clients feel that they're able to use it as well. So recognizing osteoarthritis in patients is our first step, and that could be difficult. But providing a therapeutic plan of action, that's the next step, and that takes just as much work. The type of therapeutic plan, we don't use monotherapies. We use what's called multimodal therapeutic plan that we tailor to each patient, because every patient's going to be different, and you adjust it according to how that patient is doing. Again, most of you know this. Monotherapy, it's very limited in its efficacy, all right? If we use a multimodal approach, we're going to be able to better manage the chronic maladaptive kind of pain, which most of these dogs who have arthritis have. You hit pain on different levels, you hit it utilizing different combinations of therapy, the animals respond better. Tailor it to each patient. The owners are very important in part of the plan because they're going to be part of the team that says, okay, I need to call my vet, I need to talk to you because things are not working, or this works really well. What we use, the interventions we use, should be appropriate for that animal. You know, there are many, we're going to get into many different things that we can do. It doesn't mean that every animal comes in has to have everything done to it. It doesn't need laser and treadmill and acupuncture. I always tell people, leave something to fall back on. So when one therapy isn't working or you need to add something, you have some place to go, all right? And that goes too with money. This is a long-term management, hopefully. And if that owner is putting all their finances into everything at one time, by the time you get down 2 years, they're going to be like, I'm tapped out. But if we start slow and steady, when we need something more, we can add it. And most of the time, they're very agreeable to that. Oftentimes, we reassess our animals every few months. Sometimes people think it's a failure, our therapy is failing. It's not that the therapy is failing, it's just that we haven't kept up with osteoarthritis, which is progressing. So you have to readjust your therapies, add things, take other things, and adapt your treatment plan. What does the treatment plan consist of? Weight loss, activity modifications, environmental modifications, pain medication, anti-inflammatories, supplements like duralactin and Myos, intra-articular injections if you're into that, whether it's steroid, HA, PRP, disease-modifying OA drugs and symptom-modifying OA drugs, physical therapy, photobiomodulation, which is laser therapy, acupuncture, chiropractic, Reiki. It's all on the board. And the three that we're going to talk about, monoclonal antibody therapy, which is Solensia in cats or Librela in dogs, which is only in Europe right now. SynoventinOA, which is canine. Right now, it is only labeled for elbows, although they are doing studies with other joints like the stifle. And Myos, canine and feline muscle building formulas. But we'll just go very quickly through some of these. Single most important therapy, what is it? Easiest thing to do, hardest thing for owners to do. Weight management, okay? We know we have these Ottomans coming in all the time, right? So this is what we see walk in the clinic, right? I'm sure everybody's seen these guys, right? But this is what owners think their dogs look like. So it's really hard to talk to them and say, look, your dog is overweight, okay? Because they think they're fit. It's like, oh, he's all muscle, doc. Yeah, somewhere underneath that fat, right? And same thing for cats. You know, they see these, they think that this is normal. Like this little cat with this little head here, like they think that that's totally normal. He's just he's big boned. I was like, I'm big boned too, but not really true, right? It's not what you look like or what they look like that matters. It's what they see or what you see. It's our task to really gently kind of motivate owners to say, hey, your dog needs to lose weight. Let's see how we can do that. It's not an easy task. They have to recognize and they have to want to work for it. And everybody in the house has to want to do it. Because if you have the grandpa who's still feeding the treats, guess where the dog's going to spend most of its time? With grandpa. Excessive body weight, we used to always believe it was just, you know, the extra weight that caused the mechanical load and forces on the knee. They actually found that white adipose tissue is actually not inert. It actually produces pro-inflammatory cytokines, which progress the osteoarthritis. So more weight that they're carrying, yes, it's mechanical, but yes, there's also this, you know, mediating the inflammatory process itself. Only 6% weight loss, animals will improve in their lameness. So kind of look at little things. When you look at a dog and it says you've got to lose 20 pounds, and there are dogs that we're looking at 20 to 25 pounds, we have to break it up and just say, okay, we're going to try to lose this much weight, and we're going to keep it steady, and then we're going to lose a little bit more, all right? We've got to make it achievable. If you don't make it achievable, people get frustrated and angry, and they can't do it anymore. So anti-inflammatory drugs, both cats and dogs. You know, there are plenty of, we're all used to using carprofen, Rimadyl, Deramax, meloxicam in dogs, and I think we do a great job of doing that. But sometimes we forget there are anti-inflammatories we can use in cats as well. And nothing works better than an anti-inflammatory, all right? Used judiciously, you know, it's a great part. It's the cornerstone of our osteoarthritis therapies. One thing always titrate to the lowest effective dose if you can. Like if you're using Rimadyl and the dog is going to be on it chronically, try to reduce it. And especially if you're using all these other supplements and anti-inflammatory supplements, you may be able to get it down. Like instead of Rimadyl twice a day, every day, you can do it 3 times a week, and the dog is doing fairly well. Of course, they always have the opportunity that if there's a problem, they can go ahead and increase that again too. Duralactin is a product that I like to use. It is a microlactin or a milk protein that has anti-inflammatory properties. It does not work like your regular, COX inhibitors or Galliprant. It actually works on macrophages, which we know are an important cell in the line for inflammation. So it works. It takes about 10 to 14 days. Sometimes they say 7 days to get in their system. It is a milk protein, so the only dogs that I've really had a problem with are dogs that cannot tolerate milk, but they're kind of few and far between. But you use it every day. I think it makes a huge difference. And it comes in different formulas. Dogs come in a little tablet. You can have one that has soft chews that include like joint medication or supplements in it as well. The cats come in a paste. It comes in a capsule that you can open up in unflavored gel cap type thing that you can sprinkle on their food. And also treats and the little syringe that you can, like a horse kind of syringe that you can use. Pain medication, very important. Many times we can start with it and taper them off. Gabapentin or pregabalin, I still am a gabapentin girl. I know the surgeons are all into pregabalin. I still like gabapentin. It's easier to get. You can write a script. They can get it at their pharmacy. It's pretty cheap. Amantadine, amitriptyline, that takes care of, pain has an emotional component to it. So many of these dogs and cats have behavioral issues. Oftentimes adding amitriptyline helps. Tramadol, I put a question mark because in dogs, less than 30% of dogs will actually have a beneficial effect from tramadol, but cats, it works very well on. The only thing is it's bitter, and then you get that whole drooling thing. So I put tramadol question mark if you want, and then there's also the It's a controlled substance, very controlled, very overabused, so you can make a decision if you want to use something like that. And buprenorphine, acetaminophen, and codeine, I oftentimes will add acetaminophen to dogs, not to cats, but to dogs, much lower dose, but it does help add a little more extra anti-inflammatory and pain management. I don't usually keep them on long term, but for dogs who are at the end of life, it is a very good thing to add, okay? People are always like, but it's toxic, but not at the doses that we're using it at. Adequan, how many people use Adequan? All right, it's a wonderful disease-modifying drug. You could teach owners. I tell people all the time, we can do it subcutaneously now. Makes it very easy, not only for your techs if they're going to have people come in for it, but also owners can learn how to give sub-Q injections. Generally, for both dogs and cats, you'll start twice a week for 4 injections, go to once a week, and I usually drop and taper very slowly just so we can see where the dog or cat needs it the most. So I'll do twice a week for 4 injections, then once a week for 4 injections, then every other week, and slowly then get to every 3rd week. Most dogs who have really bad osteoarthritis, you find that between 3 and 4 weeks is where they need it. Cats, usually they do okay once a month, and it's safe. We worry if they're going to have surgery, we will stop because it is heparin-like in its action. So before surgery, a few days before, we will stop it. So symptom-modifying osteoarthritic drugs, everybody has their own take on whether they feel glucosamine, chondroitin, green lip mussels, collagen, if they're effective. I say, what have you got to lose? If it's going to help that pet, it's really important to give it to them. Omega fatty acids, we know, definitely help. Unfortunately, the doses that we have to use oftentimes for true anti-inflammatory effect are very high. A lot of animals will get, or dogs, even the cats will get diarrhea from it. So if we're going to start, we start at a lower dose and start tapering up to the animal's tolerance. Glucosamine, chondroitin, hyaluronic acid, it comes in all different forms. You can have capsules, you can have pastes, you can have liquid. Green lip mussels are included in a lot of the joint supplements like combos. Collagen is also very important for ligaments and tendons. The eggshell membrane is like Dosequin has eggshell membrane. Movaflex has eggshell membrane. They found that the eggshell membrane does have a lot to do with flexibility in the joint. Then we have, the AUS, turmeric, boswellia, CBD. Those are all things that if owners want to use it, certainly it's something that they can try. Therapeutic modalities, that's where we go into, laser therapy, therapeutic ultrasound, like some of extra shockwave therapy, underwater treadmill, swim therapy. These are things owners can look to have done to help with mobility in both dogs. You can do exercises too, and in cats. And acupuncture, chiropractic, massage, and Reiki, they're very important parts of what make an animal comfortable. Owners can learn how to do massage. Some owners also have learned how to do Reiki. They can go chiropractic practitioners, and of course acupuncture. Same thing for the cat. Everything that we can do for a cat, pretty much we can do for the dog as well. They can even go in the treadmill. Everybody always asks that. It's a little bit trickier, but it can be done. Playing for cats and using enrichment toys, that's how we exercise cats. It's very difficult at home, especially to kind of pick up a leg and do that. But if you play with a cat, you can mimic exercises using laser pointers, using food balls, using string toys, things like that. Owners can also do cryotherapy if they're at home and the dog or cat is painful. They can use cold packs, massage. You can buy CC loops or PEMF units, LED light therapy. I would have years ago laughed, but there are some good units right now. LumaSoothe 2 is one of them that I've used consistently with clients. They can buy it online, and they can use it at home in between their other therapies that they're getting. I just bought my dog one, and she enjoyed it when I did it yesterday. So same thing for the cat. Environmental adaptations, that's very important because we have dogs who cannot go upstairs. We have dogs who cannot jump on the bed. We have dogs who cannot stand. So it's really important that owners understand the more we can help them using help them up harnesses, using ramps, using little steps, using gates to keep them from going up the steps. That is going to be essential in helping these dogs not get hurt and to stay safe. Same thing for cats. You can use little steps for them. Feeding bowls that are a little bit raised, low-lipped litter boxes. People complain that their animals won't get in or urinating out of the box and their litter box is this high. Well, a 17-year-old cat might not be able to do that, may not be able to get into it. So we tell them low-lipped, and they actually make them now low-lipped so that you can use them. All right, so this is where I wanted to get. I just wanted to give you kind of like a little short, little travel through OA. But the three things that I really wanted to talk about were Solensia, SynoventinOA, and Myos canine muscle building formula. So I just wanted to point out that when we're talking about pain, there are so many cells, so many mediators, so many cytokines that are involved with pain. And today we're going to talk about Solensia, which, if you notice here, Solensia, it's the track 2 that we're going to be talking about, and SynoventinOA with the macrophages. Again, this is Solensia. How many people are using Solensia now? Great. And do you find that, is it helpful?
Yes, I mean, we just started, so we're trying to get some of the cats to that second month.
Mm-hmm.
And I find that cat owners are a little nervous to use anything new.
Mm-hmm.
But the ones that do use it
are happy. Yeah, we have quite a number of our techs who are using it and a few clients as well. It's funny because they'll be nervous about getting the injection, but by the time they come in for the second, many of them are already having that, it takes like 14 days before you start seeing real signs. But then once they get to that month, it's amazing. People are like, okay, I think I see a difference. By the time you see them for the second injection, they're definitely seeing a difference. And I think it's not cost prohibited. I think that most people, if they're giving a lot of other things, doing laser therapy, doing all the supplements, I think it helps to just have that one injection. They do say when you're using Solensia that you probably don't want to use other therapies at the same time. Most people are still having them on other things, but they say you should cut everything else out just to use the Solensia. But so Solensia is an anti-nerve growth factor, NGF, monoclonal antibody. What's the other monoclonal antibody medication that people are using? Do you know which one it is? Cytopoint. Everybody uses the Cytopoint. But this is very similar. You have to remember monoclonal antibodies are species specific. So there's dog and there's cat. It is very specific for that target. So anti-NGF is not going to affect anything else. It's only going to connect to that growth factor, nerve growth factor. Nerve growth factor is one of the key players in the transmission of pain. So when anti-NGF antibodies bind, so the monoclonal antibody binds to the NGF can't cross into the track. Track won't make that connection with the receptor, and so it won't go down the whole line of producing neurotransmitters and increasing pain. So the end result is you're reducing pain expression. It's not metabolized by the liver or the kidneys. It's broken down to amino acids. It's a protein, so theoretically it's safe, and the animals don't have reactions to it. And we'll talk about that in a moment. It is a monthly sub-Q injection. Owners do not do this at home like the Adequan. They need to come into the office and have that done. There is the Solensia for cats. And there's Librela for dogs. Librela is only in Europe and Canada presently. It is not yet in the United States, FDA approved. So this is what I was just talking about. You have the anti-NGF, the monoclonal antibody right here. It attaches to the NGF, so the NGF cannot attach. That complex can attach to the TRAC molecule or receptor, and then it can't go down the whole line to cause pain. There's not going to be any binding to the track. You're not going to have more NGF being produced. You're not going to have any of the other neurotransmitters being overproduced and causing sensitizing the pet to pain. When you use Solensia, it's very simple. It's one bottle up to 15 pounds. It's 2 vials for 15 to 30 pounds. And again, it's done subcutaneously and once a month. Oh, let's go back to that for a second. So one point that I did want to make, that when we're talking about side effects, the only side effects that they initially were reporting were scratching of the face, vomiting, pruritus. And what happened was, well, the other thing that they can get is called they're called anti-drug antibodies. That's when the body starts creating antibodies to the Solensia. So what happens is that the Solensia is no longer effective. So if you're giving injections and after the second or third there's no chance of improvement, the owner's not seeing anything, you're not seeing anything, you have to be concerned that perhaps that animal has these antibodies. The other thing is, it says not to use it concurrently with NSAIDs. This is coming from human literature. In humans, there's a problem called rapidly progressing OA, and it's a reaction to steroids. And when they found that when they were using in humans Solensia with the NSAIDs, there was in humans this rapidly progressing osteoarthritis occurring more frequently, since it's relatively rare. Usually it's people who are on it for greater than 90 days and at high doses of NSAIDs, but they do recommend that if you're going to use Solensia, maybe take off the cats on NSAID to take them off of that. All right. It's safe with other monoclonal antibodies that you may use, like in dogs with Cytopoint. The studies were done in cats that were stage 1 and 2. As far as stages, IRIS stage 3 and 4, they have not done any further studies on that. The product should, my guru, Dr. Anderson, don't look around, it's you. She always says nothing in life is free. And so when you're talking to owners, most of our cats are going to be in some degree, especially if they're older, stage 1, stage 2, some of them might be stage 3. We have to do a risk-benefit analysis and say, well, I understand that your cat has some renal issues, but your cat is in pain. We can help your cat. We do have to understand that there may be some chance of an adverse reaction or not working. But it is well worth the chance to make your cat, for whatever time your cat has left, feel better. So that is a discussion that is very important with the owner to say, there's a benefit. If you don't think the risks are worth it, then we won't do it. But if you are complaining that your pet is having a poor quality of life, then we should talk about it and we should probably try it. The onset of action, usually it's a steady state within 2 weeks, or within 2 monthly injections. Within 2 weeks, you'll start seeing some changes. 77% of cats will have improvement within that first injection, second injection. You'll see a difference, and by the third injection, it's at 77% that they're seeing improvement. These were the adverse side effects: vomiting, injection site pain, obviously number one of the things, diarrhea, renal insufficiency. I'm not quite sure. I actually called Zoetis, and they did not update any of their adverse reactions. And the reason why that's important is because in the dog in Europe, there have been some changes, but it has not affected cats as of right now. So these are the things that we mostly look at: vomiting, injection site pain, head itching, shaking, and scratching. Dr. Weinstein used it, and she had 2 cats, I think, that she said had facial scratching. So the dog form, okay? Right now, I'm just bringing this up because we don't know if this product is going to be coming to us anytime soon. But if it does, there are some things that we're seeing change since it was introduced in November of 2020 in Europe and in Canada. Again, it works the same as the cat monoclonal antibody, as the Solensia, but it's called Librela. Over the past 2 years, there's what we call ongoing pharmacovigilance, and that's adverse reporting, adverse reaction reporting, adverse event reporting. In Europe, they found that by 2021, 22, that there was a big increase in the number of side effects. And it was not just the vomiting, diarrhea, or lethargy. The other thing that is interesting is that I put this little Librella experiences. If you want to know the truth of what's going on with the drug, sometimes, getting on one of these Facebook groups is very interesting. You have groups of people who are like, I'll never use it again because my dog had this. But you have people who are like, it was well worth it because my dog got another 6 months of life. But this group has been working really hard to update the adverse event reporting in Europe. So now, the adverse, as of January of 2023, they've actually added systemic effects: polydipsia, lack of efficacy, death, lethargy, and anorexia. Renal urinary disorders, polyuria, urinary incontinence, diarrhea, vomiting, and then a lot of neurologic signs that they've been seeing, like ataxia, weakness, and seizures. Now, a lot. When you talk about the thousands of animals that are getting this injection, and you have a handful of animals having side effects, it's still a great drug. But we just need to be vigilant to tell people, because if your client's the one that suffers these, dog suffers these types of side effects, they're going to be kind of angry at you. Why didn't you tell me? Again, still risk-benefit assessment. Your dog's not walking. If we don't do anything, she's not going to live to next week, or you're going to put her to sleep. So let's try something, okay? The second one that we're going to talk about is SynoventinOA. It is probably going to be more something that you'd refer for. It breaks the cycle of inflammation by using a radiotin injection into the joint. It is probably not something, because it requires a RAM license, a radioactive material license, that most practices are going to be doing. But it is something that you can offer your patients and then refer them. There are several places, like right now I think Crown and North Star are the only ones that in this area that are doing it. It's one injection, and it can last up to a year. Right now, it is only labeled for elbows. I'm sure that'll change over time. So what is it? It is a radioactive tin 117. It is a single intra-articular injection. Usually, it's considered a device. It's not considered a medication. Veterinarian has to administer it. Usually, the animal's brought into the hospital because there's a lot of checking that they have to do because it's radioactive. We have to, check the animal, check the area, with the Geiger counter, and kind of do a lot of control with that. It has a duration of effect that can last up to a year. They say 9 to 12 months in most cases. And once that year is up, it can be repeated. There's no systemic distribution. Once the radiotin is small enough to be in the joint and be engulfed by the macrophages, but big enough that it won't come out of the joint. So it's very localized to just the joint. There's no effects on the kidneys and GI, hepatic, and immune function. There is some discomfort that can occur in the elbow that's being injected. That could be up to 72 hours post-op. You can use it just as an individual therapy. You can also use it with other modalities. If you're going to do it, I always say, like, laser should not be something that you use concurrently, like at the same time. Wait a few weeks before you actually do laser again. Dogs have to be over a year of age, and right now it is only labeled for elbows. I'm sure that will change over time. I know that there are certain places that are doing current trials on stifles, because that would be a great joint to be able to treat. 92% of dogs with grade 1 and 2 elbow osteoarthritis will see efficacy of, I forgot what they said, within 30 days. 71% of grade 3 and 4 and remember that's pretty severe OA, will have a positive effect. That therapeutic effect can last 9 to 12 months. And it's important to let owners know that because it is not an inexpensive therapy, but if it can last 9 to 12 months and they don't have to use anything else, it works out to be less expensive than using everything in combination. So why does it work? Well, synovitis is one of the key factors in pain and the discomfort of osteoarthritis. So in this little chart, you can see there's some sort of instability in the joint. Synovitis occurs. You have hyperplasia of the synovia. There's increases in macrophage and synovitis. Those produce more pro-inflammatory cytokines, and it creates a whole pattern to kind of build on pain and inflammation. Macrophages, in this case, are going to be the target. They're the ones that can overproduce the pro-inflammatory cytokines like IL-1, TNF, and MMPs. By destroying the macrophages, we're going to break this whole cycle. So I know you're going to ask me to say this, and I can't. I'll be very honest, but I don't feel bad because Dr. Fox can barely say it. But the process is radiosynovirothesis, where we're using, I don't know, I didn't make up the word. Dr. Fox was very funny when he goes through his thing. He's like, he has to say it nice and slow as well, so I don't feel bad. But I'm going to show this little video, and it's going to show what happens. But if you follow, following the injection, the radio tin will then float around the joint. It's phagocytized by the macrophages. The macrophages are killed. They're engulfed. The cells that are cleaning up and engulfing the macrophages will also be destroyed. And within time, all that inflammation is settled down. And that lasts for at least 70 days as far as that effect of that phagocytosis occurring. And then the therapeutic effect will last for up to a year, 9 to 12 months. All right, let's see if this works. Should we try?
Chronic osteoarthritis, or OA, is one of the most significant debilitating conditions in companion animal health, afflicting up to 20 million dogs in the U.S. Current treatment options can cause systemic side effects, are short-acting, or only target pain receptors, and thus may not fully address this disease that creates such discomfort for the dog. Inside the OA disease joint, a vicious cycle of inflammation causes the synovial membrane to swell and the cartilage to deteriorate. The overproduction of inflammatory macrophages and synoviocytes creates ongoing progressive inflammation and pain. SynoventinOA provides long-lasting pain and inflammation relief by the dual targeting of these underlying drivers of joint disease. SynoventinOA is a veterinary device consisting of microparticles of the novel radionuclide tin-117M. These particles are suspended in a colloid, which is injected into the joint to safely and effectively treat synovitis for up to 1 year. The appropriately sized tin-117M microparticles stay in the joint and emit low-energy conversion electrons with only a 0.3 millimeter range of activity. This provides targeted, precise, non-systemic therapy with no clinically significant local or systemic side effects. Inflammatory macrophages and synoviocytes selectively engulf the SynoventinOA microparticles and are subsequently deactivated by the conversion electron energy. The microparticles remain active and are engulfed again by nearby synoviocytes and macrophages for sustained action against inflammation. SynoventinOA microparticles decay to harmless, inert tin, but its clinical effects last up to a year with just one injection, providing durable pain and inflammation relief and helping to restore active living.
See, I think a picture in a movie is worth 1,000 words. I like that little so. The thing with this product is that it's radioactive. So it requires a RAM license or a radioactive material license. It requires training in radiation safety. There are procedures for handling and the use of radioactive materials. There's training in measuring and recording using the Geiger counter prior to release of the animal. There's screening procedures. It's very interesting, the screening procedures that they use for this product before they figure out if this animal is going to be able to get it and what category that animal's in. It all depends on how close the interaction is between the owner or the people in the household and the pet. And so they have to, whether their dog lays on their chest or laying on their feet, all of that is the distance between where they're going to get treated and your body part. And so that will make, where it says whether they're a co-sleeper, whether they're a lap sitter, that's going to help us determine if this animal and what type of treatment that animal is going to get. All right. I created a whole procedure. Exuberant is great with providing you with all the information, and once you get into it, trying to figure out what kind of patient this is going to be and how long are they going to be having to be away from the owners or not in close contact. It's very interesting to figure out, and that's something that is really important to talk to the owners about, because for at least the first 2 weeks there's going to be limited contact. There's going to be timing, like 15-minute walk on a leash. It's not going to be they're just going to go home and jump on the animal or dog's going to jump on the bed and sleep with the owner right next to him. So there are some things that the owner has to be aware of when we're doing this treatment. And again, I just wanted to put this up here for just so you can see, they talk about the time that they can be within 3 feet, the time that they can be on their walks, the time that they can be close to them within 1 foot. It varies through the timing of after the injection and also the type of interaction the client has with their dog. Some people will have a problem with this. The other thing in New Jersey, and this is just in New Jersey, any child under 5 and pregnant women for everybody, but children under 5 cannot be in the house with the dog for the first few weeks. So it's right. What do you do? So it's something to really talk about clients with. If you want to do this and you have a 3-year-old, we're going to have to board the dog for 2 weeks. So it is a very safe device. It's a very safe procedure for the animal and post-treatment, but they just are being very, very careful that there's no problems. This was just last week. Forbes had an article, Dog's Best Friend, a new pain management treatment for osteoarthritis is a hit with dog owners. And the reason I put this up here is because people are going to start reading about this. People are going to start asking about it. So if you are interested, you can have handouts about, or the little pamphlet that the company gives, but you should tell them we don't do this here, but we have referral places that we can send you to. It does work wonderfully, but it's work as far as on your end not to have contact with the dog during the time, 2 weeks, that 2-week period. The last product I want to talk to you about is Myos muscle building formula. It's called Foretropin. It is a proprietary advanced nutrition product made by Myos. It's an egg protein that they've found, and they've done recently quite a bit of studies on it as far as how it works and if it works. You can read on their site, you can read any of these clinical studies. They're very interesting. We have muscle loss that's due to disuse and injury. So, you have your animals who have had TPLO surgeries, and that was one of their studies that they specifically looked at. You have sarcopenia, or muscle loss that's due to aging without any disease process going on. And you have cachexia, which are muscle loss that's due to an underlying disease. They're all any sort of muscle loss can be associated with an increase of mortality. There's a complex multifactorial mechanism. It's physical inactivity, decreased growth hormone levels, decreased testosterone levels, changes in muscles, insulin resistance. There's so many things that can lead to this increased mortality due to muscle loss. So again, the Myo active ingredient is Foretropin. It is a natural myostatin-reducing agent or inhibitor. It decreases circulating myostatin by 18 to 22% and reduces the degree of muscle atrophy. So why target myostatin? So myostatin, aka growth differentiating factor 8, promotes atrophy and inhibits the growth of muscle cells. We all have that in our body. The myostatin levels increase with response to inflammation. They increase with aging. It increases with inactivity and increases with steroid use. An increase in myostatin reduces muscle mass, increases muscle atrophy, increases muscle protein breakdown, and reduces protein synthesis, which is all basically you get a smaller muscle. So what happens if you inhibit myostatin? And this might look funny, but these are real animals. All right, I'm sure you all remember double muscling in animals, okay? These are all animals that have genetic loss of myostatin. The gene of myostatin is not normal. So they develop these huge muscles. So you would think, like, you have these huge muscles that better function, okay? They're gonna be stronger, and that's not actually the truth. Animals like this and people will also have, less strength, more cramping, inability to throw things. Well, in humans, inability to throw things. And I laugh because when I was in high school, I had friends who were bodybuilders, and they were quite large, and they were great to look at, except they couldn't throw a ball for anything. Like, I could throw a ball, but my grandmother could throw a ball better than they can. But it's the same thing. The function is not there. The muscles are interfering with movement. But this is just a good sign, good little picture in your mind that when we don't have myostatin, which myostatin causes muscle atrophy, we have muscle building, or we have a lot of muscle. So if we can inhibit it, we can hopefully build more muscle in these animals that have disuse atrophy or have cachexia or sarcopenia. Next month is May. We're not in May yet. So in June, I forget when it is, at the ACVIM, Myos is going to be presenting a paper. This was the press release of using Foretropin in cats, specifically cats with renal insufficiency, because we know how many cats do we have that have renal insufficiency and they're teeny weeny, and they're losing muscle, and with that loss of muscle, of course, they become weaker. So their study was done in cats that are in stage 1 and 2, the iris staging, or 2 and 3, I should say, and they've tolerated it well. They lost less muscle than cats who were not on it, and they actually found that in 70% of cases, there was some change or improvement in their muscle. So this trial was conducted at NC State. There's going to be some papers after June 13th. Mr. Salerno, who's at Myos, told me that we'll be able to get some of those papers. Myos comes in feline and canine products. The feline right now is just the muscle formula, the Foretropin itself. In dogs, there are several different types. There is a Foretropin that's just a Myos product that's just Foretropin. There is a veterinary product that has Foretropin plus branch-chain amino acids, which are very helpful for muscle. And then they also have the Foretropin with green-lipped muscle. They also have this, and this is important if you're going to use this muscle and mobility. That is more a joint supplement. It does not include Foretropin. So when owners, they'll get online and they'll go to order it, tell them not to get this one, the muscle and mobility, because it does not have the Foretropin. So yes, it will have the collagen in it. It'll have glucosamine. It'll be great for the joint, but it's not going to do anything for the muscles. All right. So it's very important. The other 3 you can use. This is some contact information. I urge you that if you have questions about a product that you want to use, I reached out to all 3 of these companies, and they were absolutely wonderful. They answered all my questions. They were very happy to come and talk to us, do lunch and learns. So Zoetis also has a lot on their information for feline OA and canine OA, all the OA checklists and things that owners can, sites that owners can get on, and so does Myos. So if you have questions or if you want more information, you certainly can contact, I put down the contact information right there. Sorry, I know that was going through a lot of stuff fast, but how about some questions?
Do you have any experience using Do you have any experience using the Myos product?
I use it a lot.
And when do you advocate to start using it?
So I have a lot of our pain management older patients, our geriatric patients. I always talk to owners. It's in my general form that I have of things to use. I always start them on joint supplement. If they're not on it, oftentimes we'll start them on Duralactin. I will also tell them if the dog has muscle atrophy, that we should start it. The sooner you start it, the better it's going to be. Like, remember, it's going to improve it by 18 to 22%. All right, which isn't it's enough. It's not 100% though. And every day that dog or cat is going to continue to lose muscle. So if we can get them to stabilize and not lose more, that's a win. So I try to start it as soon as possible. Again, finances oftentimes are an issue. Joint supplements are expensive. Laser therapy. Underwater treadmill if you're going to use it. If you start adding everything up, they may say, well, I'll try that in a month or two. But I always tell them, if you can get it, please start it right away. The sooner you start it, the better. So, Isla, you should know all these questions. You should be going ahead. Isla's one of my techs, by the way. And so is Marta next door. They're wonderful.
And she loves working with me, too.
And I love working with you guys.
Regarding the Synovetin, is there any contraindications regarding the animal itself, like if it has kidney or liver disease or any comorbidities?
No,
or
because it's localized. It's just in the joint, does not become systemic. So, having said that, many times you have to sedate the dog to do the joint injections. So, of course, your normal considerations for sedation. Some dogs, I have to say no. I would say you have to sedate the dogs. No dog's going to let you do that. And you wouldn't want to miss, especially since it's a radioactive injection, you don't want to miss or inject yourself. So it's going to be probably done under sedation. I thank you. Thanks for coming, everybody.